What is up, everyone? Welcome back to another video. It's Medicine with AUNO. So we are back with another anatomy video about the back. So we're back with the back. Make sure to hit that subscribe button if you haven't yet to help me out. So this video is a little longer, but we are going to learn a lot together. So let's dive right in. We have a 50-year-old male with severe coughing admitted to the hospital. Radiologic examination is consistent with tuberculosis of the right lung, with extension to the thoracic vertebral bodies of T6 and T7, producing a gibbous deformity. Which of the following conditions is most likely also to be confirmed by radiologic examination? Hyperlordosis, hyperkyphosis, scoliosis, spina bifida, or osteoarthritis. So if we know these terms and we know what gibbous deformity is, we got the answer. But let's not stop there, because we go all the way, y'all. So tuberculosis, what is this? It's caused by a bacteria called Mycobacterium tuberculosis. It's an infectious disease which generally affects the lungs, but it can spread to other parts of the body, as we see here. Many times patients are asymptomatic, and it's called latent TB. 10% of those will lead to active disease, in which about 50% will die without proper treatment. So the risk of developing active disease and worse outcomes is much higher in immunocompromised individuals, malnourished, alcohol abusers, and smokers. Symptoms include chronic productive cough with occasional sputum, blood, chest pains, fever, night sweats, weight loss. And these can be mild for many months. And as said, it can spread to other parts of the body, such as the musculoskeletal system, and spinal tuberculosis is about 50% of those. So spinal involvement is usually the result of hematogenous spread of this bacteria. So it spreads through the blood into the cancellous bone of the vertebral bodies. And primary infection site, as in our case, is a pulmonary lesion, or it can be an infection of the urogenital system. Chest x-ray. They had a chest x-ray, right? Examination, radiographic examination. This is showing some patchy opacification on the upper right zone of lung, consistent with TB. And over here, another one shows the same type of thing, upper right opacification. And then some hilar. I'm not sure how to pronounce this. Y'all go help me out in the comments. Hilar, lymphadenopathy. So the hilar area of the lung, I believe, is like right here. So you see this. And you can compare it here. You don't really see it on this x-ray of this patient. But just some lymph node involvement or infection, right? So then they do this. This is x-ray, CT, MRI. Get it all done, right? So gibbous deformity. Actually, these are all different patients, I think. But gibbous deformity basically means hunchback, pronounced, my bad, it doesn't mean hunchback, but it leads to a hunchback appearance and pronounced kyphosis. So we already know the answer is hyperkyphosis, but we're not going to stop there, y'all. But we see this hunchback appearance here on the CT scan, here on the x-ray, and MRI. So gibbous deformity is a form of structural kyphosis that's found in the upper lumbar or lower thoracic, as in our case, thoracic vertebrae. One or more adjacent vertebrae become wedged. We can see wedging here. We'll look at that. Gibbous deformity most often develops in children as a result of spinal tuberculosis. Here's a 50-year-old, though, with it. And it's a result of collapse of the vertebral bodies. Collapsed vertebral bodies, anterior wedging seen here, and up here. Okay. So MRI is going to show involvement of vertebral bodies on either side of the disc. Here's a disc. The disc is going to be destroyed. You might see an abscess. You might have vertebral collapse as seen here. Vertebral column deformities. And here is a wedging. So, as said, one or more adjacent vertebrae can become wedged. This is wedging of vertebrae here. Right there. And it kind of looks like this. And it kind of looks like that as well. Although, not sure what's going on there. So, usually when this spreads to the spine, there's destruction of the intervertebral disc space. We see that right here. Here's intervertebral disc spaces here, nice and well seen. But here, this is pretty much squashed. Collapse of spinal elements and anterior wedging, leading to hyperkyphosis or gibbous deformity. So we see this anterior wedging right here, and then it's leading to this collapse of vertebral body and this gibbous formation, hyperkyphosis. So that's our answer. The other options here, so here's our kyphosis, our hunchback. Here's lordosis, which is where the lumbar spine is like curved backwards. And I guess you can think of this as concave in the front here anteriorly. Here you have concave in the posterior part of the back. And this can happen in pregnancy and other things. It's scoliosis. So, our other answer choices: hyperlordosis. Hyperlordosis, exaggerated lumbar curvature, right? Hyperkyphosis was our answer. We see that here. Scoliosis, lateral curvature of the spine. Spina bifida, I have no clue. Oh yeah, what's going on here? We're missing a spinous process, but I don't know why. But that's like a more minor form. Then you have these other forms of this. And then osteoarthritis. You know, we can see bone spurring, narrow disc. But yeah, the only one that's going to cause this gibbous deformity, which we need to know what that means, is going to be our hyperkyphosis is going to be seen in that, right? So yeah. Second question, y'all, let's go. So we have a 68-year-old male now brought to the hospital with severe back pain that began insidiously 4 months ago. Slow onset, just kind of came on, you know, slowly. He has no history of recent trauma or strenuous activities. Physical exam shows muscular strength of 5 out of 5, normal sensory findings. An x-ray was done showing severe osteoporosis of the vertebral column with compression fractures to vertebrae L4 and L5. Which of the following parts of the vertebrae are most likely fractured in this patient? Okay, so first off, severe osteoporosis. What is this? Osteoporosis is porous bone. Okay, we have normal bone, and then you can see it looks like it's kind of getting destroyed. Osteoporosis, this honeycomb look, but these are getting bigger, pores in them. Okay, normal bone, abnormal. So osteoporosis, this is a systemic skeletal disorder characterized by low bone mass, microarchitectural deterioration, which we see, of bone tissue leading to bone fragility, and it can lead to a fracture. So it's the most common cause of a fracture in the elderly. So again, here, bones that commonly break in people who have osteoporosis include the vertebrae, the humerus, the distal forearm. Here's a radius fracture that was fixed, and the hip. This is a femoral head or neck or junction fracture, I don't know. Y'all, again, we're learning this together, all right? I don't know any more than y'all do. Y'all probably know more than me, so help me out in the comments. Until a fracture occurs, there are typically no symptoms. Bones can weaken to such a degree that a break may occur with minor stress or spontaneously, and after the broken bone heals, that person may have chronic pain and a decreased ability to carry out normal activities. So you can see here, loss of height from compression fracture, and this hunchback again, this hyperkyphosis can develop. Let's talk about causes. We're getting to the answer, but we want to break this down. What can cause osteoporosis? So, either lower than normal maximal bone mass or a greater than normal bone loss can lead to this. So we know that bone loss increases after menopause because estrogen levels will decrease, and that has some role to play with that. Alcoholism is not good. Anorexia, hypothyroidism, kidney disease, ovary removal, chemotherapy, proton pump inhibitors, SSRIs, steroids, smoking, and lack of exercise, right? So now we're getting to the good stuff. When a vertebral compression fracture takes place, someone's going to have sudden onset back pain, an increased pain intensity while standing or walking, decreased pain while lying down on their back, limited spinal mobility, eventual height loss, which we saw here, radicular pain down arms or legs. I think they can have that, but I mean, it would make sense that the spinal cord gets damaged, but it depends. wear and how significant the fracture was. And it can lead to deformity, right? And we see that again. Spinal deformity. And the pain can be worse when coughing, lifting, or sneezing because these put more pressure on the spinal column. So this patient ended up with an x-ray, right? And it showed osteoporosis and compression fractures of L4, L5. Well, here is an x-ray, L4, L5 compression fractures. You can see wedge-shaped vertebra or loss of height of the vertebra. Honestly, I'm not really sure what we were looking at, so I found another x-ray with a compression fracture at L1. So this is normal. And I noted this disc space here. I don't see it here. Now, I don't know if that's specific for a compression fracture, but it, to me, tells me this is abnormal, right? Sometimes you can miss these on x-rays, so you might want to get the CT MRI. This L1, you can see disc space up here, and here maybe not so much, so possibly that's what's going on. Here's a some gallstones in the gallbladder, also incidental finding. And here's lateral views of these two x-rays. We can see something's going on at L4, L5. Here's this L4. And not sure what's going on here, but it just doesn't look in line with the rest of the vertebral bodies. It kind of looks more calcified, or I don't know what you call this, dense, higher density. And this is the L1 compression fracture. Now here you can see some anterior, I guess you could call this wedging, I don't know. But this, you can see the vertebral body is kind of mashed. It doesn't look as normal. And we can see up here, these are almost touching. So, and yeah, up here, these are like hitting. So that's what we have here. But here's a CT actually of this case with the, this is the L1 compression fracture, so right up here. And we can see right here, the same vertebral body has been fractured. So CT is going to show it better than the x-ray. So, finally, we're getting to the answer. Crush fractures are characterized by compression of entire vertebral body, and wedge fractures are seen involving the perimeter. They can have more minute perimeter fractures around the vertebral body, but both can cause reductions in overall height. So these are compression fractures. So compression fractures, pressure, degeneration of bones, osteoporosis, wedge fracture, burst fracture. So these all are involving the vertebral bodies, right? They're not involving anything else. So we're going to look at that. Vertebral body is what we are seeing getting involved in this compression fracture. So that's going to be our answer. Vertebral bodies will be the most likely fractured part. But let's look at these other parts. Spinous process, so that's not going to be the compression fracture. For transverse process up here, no. And then we have superior articular process right here, superior facet, and right here, superior costal facet, and yeah, intervertebral disc. So what's going to happen there? So you might see fracture of spinous process, transverse process, or the superior articular process with an oblique transverse or comminuted fracture. This is spinous process fracture here. So not compression fracture. Compression fracture is collapsing the vertebra. And we'll see compression. We can see the wedge fracture. So that's going to be our answer here in this patient with osteoporosis. With a compression fracture, we will see the vertebral body being collapsed, fracture in the vertebral body because of the pressure and the weight and the bone loss, right? Osteoporosis. And the intervertebral discs, we know those aren't tend to be fractured. They're not bone, they're discs, right? I think they're cartilage. Someone confirm that for me. But we see the herniated disc, and this can cause some problems, right? It can go into the spinal canal. We can see thinning disc, bulging disc, degenerative disc, which is the osteoporosis normal disc. And here's a disc with some problems, osteophyte formation. So that's that question. So hopefully we have that down, that when we have a compression fracture, we will be seeing fracture of the vertebral body. These other areas here can be fractured, but more like that, not compression related. And intervertebral disc, we don't see that being fractured. It's herniated, so it can bulge back or push back or whatever, herniate back. So last one here, y'all. This one's an easy one. 45-year-old man. He's in the hospital for 2-week history of severe lower limb and back pain. So physical exam showing some slight bilateral loss of sensation over the skin, over the lower limbs. And x-rays done showing spinal canal stenosis in the lumbar region. So what condition will be confirmed by MRI? Hypertrophy of what ligament? Supraspinous, interspinous, ligamentum flavum, nuchal ligament, anterior longitudinal ligament. So first off, spinal stenosis is where a portion of the spinal canal will narrow to the point at which it can exert pressure on the nerves that travel through the spine, leading to this pain in the lower limbs and the sensory loss. And if it's bilateral, we're going to have problems at both sides of the lower spine, both areas. So this is a X-ray and a MRI showing spinal stenosis, and we can see this black thing here, which is a ligament. I'm not going to say which ligament. Yep, is pushing in to the spinal canal, narrowing it, and it will cause some pain, right? Nerve pain. It will, and this X-ray, I'm not really sure what to look for here, but this is a spinal canal, so I guess radiologists and doctors must have some way to measure that, quantify it. So here's the ligaments, right? Nuchal ligament, right? Probably totally did not pronounce that correctly. That's in your, that's about C7 up or above C7. This is T1, C7, so above C7, we see that. So that's not going to be in the lumbar region. It's posterior, it's nowhere near the spinal canal. That's not our answer. We have the anterior longitudinal ligament. Again, we see that right here as well. That's not near our spinal canal. We see our supraspinous ligament posterior to the spinous process, and that's not near the spinal canal. We see the interspinous ligament right here, and again, that's not here near the spinal canal. And then we see the anterior longitudinal ligament out in front. We said that. Ligamentum flavum, where's that? That's right here. That's actually posterior, just posterior to the spinal canal. And when we look at the next slide, you will see that ligamentum flavum, how do you pronounce that? Flavum, the hypertrophy of this ligament can cause spinal canal stenosis, as well as, this was not an answer choice, but hypertrophy of the posterior longitudinal ligament as well can invade the spinal canal and spinal cord. So that's our answer. Both this and this ligament, posterior longitudinal and ligamentum flavum, can cause spinal canal stenosis if hypertrophied. These other things we probably don't, but this is normal. You can see the ligamentum flavum here, and here, and here. And then here you can see this excess growth. It's just bigger, right? So let's move to the next slide here. This was the MRI, because we're asking what's going to be confirmed with MRI. So before we look at that, here's our ligamentum flavum. Here's our posterior longitudinal ligaments. So both of these are capable of causing this stenosis. Here's a ligamentum flavum, hypertrophy pushing into the spinal cord, spinal canal. So MRI, here's our MRI. We can see ligamentum flavum, normal here, normal here. I don't know what it is here. It's either, it must be this black thing, or it might be this black thing. But here's hypertrophy of that ligament. Yeah, it's this black thing here, right? It's this one right here, out in front. You can see the difference. And here we can see it also. But this is going to be a really good image. So look at this image, and we'll end this whole video. This is perfect. Here is ligamentum flavum, right here, in black. It is compressing the spinal cord. It is in the spinal canal. And here it is on our diagram. Just exactly, that's a great illustration here to see on MRI and this diagram here. So when that is hypertrophy, we can see the symptoms and we can see the stenosis, and we are out, y'all. Make sure to go just smash into the, just go do something for me. Like the video. I don't care what you do with the video. Dislike it if you dislike it. You know, just do something, interact, y'all. But hope you have a great week. Keep staying in touch with me, the videos, because you're helping me stay motivated to learn so we can better help future patients and we become out in the medical fields. Anyways, I'm out, y'all. See y'all later.